Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today we have some important Medicare enrollment updates we'd like to share. It's still the first quarter of the year, so that means we're in the annual general enrollment period where you can enroll in Medicare Part B. You have to have A, but you can enroll in Medicare A and B for a Part B effective date that is July 1 of 2022, and the general enrollment period ends March 31st. So if you're on COBRA, you may have a problem. If you're still within 8 months of your active employment ending or your active group coverage ending, whichever came first, you could still use a special enrollment. But otherwise, you need to use a general enrollment period, and you do not want to miss March 31st. The first quarter of the year is also the time that individuals on Advantage plans can return to original Medicare or change Advantage plans. And the problem, as we've discussed, is it can be very difficult to return to original Medicare with a supplement. You can always return to original Medicare, but whether or not you can get a supplement beyond the 6 months after your Part B effective date gets much more dicey. So if you are in that situation, which is true in 46 of our states, you might want to consider a PPO product rather than an HMO product and change to at least an Advantage plan that gives you more of a network. We just dealt with someone facing a major procedure. It doesn't get more serious than an organ transplant. And the medical center that was the desired place to have the transplant was not in the HMO network, which would have meant no coverage. So let's move on to the special enrollment period. That's for people who had active group coverage beyond age 65. Our update there is for people to know that Social Security, which does the enrollments for Medicare A and B, is very backed up these days. And we'd like to change our advice from using the portal, the online portal that was created because in March of 2020, Social Security employees are no longer accessible. You can't make an appointment and go into the office. However, we've had some disappointments of late with the portal. We saw last fall people being enrolled almost immediately, and now things are very backed up. And my staff are saying you're better off using the route of faxing copies of the CMS L564 and CMS 40B, which you use for a special enrollment, to your local office and following up, sending it with a cover letter, sending it with tracking, but then following up by phone. There are other ways to do this. You can see all of them online. The point is you have to prove to Social Security that you've had the active group coverage. This time of year, people with group coverage are getting 1095C forms. And if you save all of those, that's one way. So there are different ways, but the most common way is to complete a CMS 40B and get your employer to complete the CMS L564. But even if you have to pay an extra month's premium, it is probably worth doing that. Not that you should, but it's very stressful when things are in process for weeks on end. We don't want to leave out the initial enrollment period. That's when most people go on to Medicare at age 65. And just a reminder, that begins 3 months before the month of your birthday. So have that on your calendar if you're retiring and want your Medicare. Well, even if you're not retiring, if you need your Medicare in place as soon as you are eligible, which for most people is the first day of the month they turn 65, have it in your calendar to get on this, to get your A and B enrollment processed. The beginning of the first month of your initial enrollment period, the workers can do that online. People who are qualifying through a spouse's work record still need to make a telephone appointment, but get on that and have that done. So much of this information is a repeat, which is the luxury of having done so many other videos and having a bit of a library of them. But the important takeaway is probably staying on top of everything and starting as early as possible. Thank you very much. Thank you for listening. Take good care. Bye-bye.